My name is Jay Border. I'm 67 years old. I'm single. I've been divorced for 5 years. I have 2 daughters. I have 3 sons. I'm an addict and an alcoholic, and currently have 33 and a half years clean and sober behind me.
I'm Dr. Eddie Brown. I'm one of the advanced heart failure doctors at what was New Mexico Heart Institute. I started in 2021 after I finished training, and I've lived in the area now for about 2.5, 3 years.
I'm Laura McDermott. I'm a nurse practitioner. I've worked with Lovelace Medical Heart Institute since graduating with my nurse practitioner certification about 10 years ago. I'm from New Mexico. I'm from Albuquerque, went to high school here, lived other places, but have been back here for over 30 years now.
So my heart trouble started Groundhog Day, or February 2nd, 2017. I woke up really early in the morning in considerable discomfort. I thought it was indigestion. I was rushed into the cath lab. Eventually 2 stents were put in. Finally, there was some relief. And so I thought, okay, maybe I was naive, but I thought, okay, you've had a heart attack and things will get better. Dad, this is enough already. Come to New Mexico. I start looking, and I end up at the Heart Institute, and my cardiologist is Laura McDermott.
When I first met Mr. Border, which was shortly after he moved to New Mexico in late 2020, he was a garden variety cardiac heart failure patient. In that moment, he needed to receive some IV Lasix or diuretic in the clinic to help get some fluid off. And once we did that, he was relatively stable for the next 18 months or so.
An LVAD, which I had never heard of ever. I had no idea that my own doctor was in charge of the LVAD program at the Heart Hospital.
Jay is a patient that I've known since June of 2023. He'd been sick for a while. He's a guy who's a little bit older, who didn't have great options when it came to the possibility of a heart transplant. And so in some patients, an LVAD is a great option because it's been shown to help improve mortality as well as quality of life. So LVAD stands for a left ventricular assist device, and it's a surgically implanted pump that replaces the function of the left side of your heart.
After that visit, my daughters and I spoke, obviously, and it was obvious to me which choice I thought was the best, but I wanted to hear from them, and they happened to agree. One of the amazing nurses at the Heart Hospital, and we start talking. And she is not an LVAD nurse, so she was not my LVAD nurse. This was before my LVAD. But her father was an LVAD patient. So she sat with us for a couple hours that afternoon and gave me more information than I could ever have learned just talking to me, because she's a wonderful human being. And so our decision was made right there, when just from talking to a nurse that had nothing to do with my situation. Every doctor and nurse at the Heart Hospital was amazing.
New Mexico is the patients, and the fact that if we weren't doing it, nobody else in the state does what we do.
Whenever I go to the Heart Institute for a follow-up, I go next door to the Heart Hospital, and I walk through there just so I can see people that helped me and thank them again and let them know how important what they did for me was.